Hi, I'm Dr. Brad Backoff, a podiatric physician at Ankle and Foot Care Centers. Today I'm here to urge people with diabetes to stay on top of their foot health to avoid complications such as diabetic foot ulcers, which are wounds that can turn into more serious complications down the road. In this video, I'll discuss what diabetic ulcers are, how they're formed, how to recognize them early on, and how to prevent and treat them. A diabetic foot ulcer is an acute or chronic wound which is a result of abnormal pressure and shear forces. Shear is rubbing, generally found on bony prominences of the foot. In addition to these forces, poor blood flow and neuropathy, which is a loss of feeling or sensation in the lower extremities, are thought to play a major role in decreasing the body's ability to repair itself and the creation of an ulcer. In this picture, what we see here is on the big toe joint of a patient's left foot, we see a callus that is turned into an ulceration, which is probably extending almost to the big toe joint. Some common risk factors include decreased blood flow to the feet, neuropathy, abnormal foot structure, poor shoe selection, kidney problems, edema, which is swelling of the lower extremities, and smoking. A diabetic ulcer typically starts out as a callus, which forms as a result of a pressure point, like you saw in the picture. Some other common symptoms you may notice are an increase in pain where you previously lacked sensation, a foul odor or drainage that may be of a red, green, or yellow color in your socks or shoes. When left untreated, ulcers can lead to other complications such as infection or the formation of an abscess, which is a collection of bacteria that usually requires surgical drainage. Another serious condition that can result from these ulcers is osteomyelitis, which is inflammation and infection in the bone. In the most serious cases, ulcers can lead to gangrene and require amputation of the lower extremities. The first and most important way is to maintain good control of your blood sugar in conjunction with your primary care physician. Wearing proper footwear is also essential, as well as performing daily foot inspections, visiting your primary care physician regularly, and your podiatrist. Here we have an example of a diabetic shoe which is available in our offices. As you can see, it's very well constructed. It is a very thick sole and it contains a lot of depth for your foot. Additionally, within these shoes, we will usually place either a heat molded or a custom insert such as this, which is very soft and which would be customized to your foot. So how do we treat these ulcers if and when they happen? We administer a combination of good local wound care and offloading, which refers to taking the weight off these ulcers and the other pressure points, usually through either a diabetic shoe such as this or by using some sort of built-up dressing. Vascular surgery may be necessary if the blood flow is poor and if it's preventing the ulcers from healing. If there is an active infection, antibiotics or, in the most severe cases, surgery or amputation may be necessary. I want to conclude by stressing that diabetic people who are at risk for ulcers and other serious complications should make a daily effort to keep on top of their foot health. Generally speaking, a diabetic should see a podiatrist at least once a year, even if you are experiencing no symptoms that I have mentioned today. If you have any questions, please contact one of our 20 offices today.